Hi, I'm Dr. Rick Duplantis, and welcome to my show, It's Your Health. You know, we are coming upon the summer months. When this show airs, it'll actually be the start of June. And with summer, we have the heat and humidity here in South Louisiana. So my topic tonight is on a very pertinent subject, heat stroke. You know, we're going to be out in this weather, doing recreation type activities, working, doing sport activities, and I felt it a need to give out a few things on heat stroke and some of the symptoms of heat stroke, treatment of heat stroke, and how to look out for the signs of heat stroke and how to address those signs. But you know, the most important thing, of course, is hydration, and we'll go to those points now on heat stroke. You know, heat stroke is the most serious form of heat injury and is considered a medical emergency. If you suspect that someone has suffered a heat stroke, also known as a sunstroke, you should call 911 immediately and give first aid until the paramedics arrive. Heat strokes can kill or cause damage to the brain and other internal organs. Although heat stroke mainly affects people over the age of 50, it also takes a toll on healthy young athletes. Heat stroke often occurs as a progression from milder heat-related illness such as heat cramps, fainting, heat exhaustion, or heat exertion. But it can strike even if you have no previous signs of heat injury whatsoever. You know, heat stroke results from this prolonged exposure to high temperatures, humidity, with a combination of dehydration, which leads to a failure of the body's temperature control system to regulate and cool the body. The medical definition of heat stroke is a core body temperature greater than 105 degrees Fahrenheit, with complications involving the central nervous system that occur after exposure to high temperatures. Other common symptoms include nausea, seizures, confusion, disorientation, sometimes loss of consciousness, or even coma with heat stroke. The hallmark symptom of heat stroke is a core body temperature above 105 degrees Fahrenheit. But fainting sometimes will be a first sign of heat stroke. Now, these other symptoms of heat stroke include throbbing headache, dizziness and lightheadedness, lack of sweating despite the intense heat, red hot and dry skin to the touch, muscle weakness or cramps, nausea and vomiting, rapid heart rate, which may be the strong or weak, rapid or shallow breathing, behavioral changes such as confusion. You may become disoriented. You may stagger. You may suffer a seizure with heat stroke. Unconsciousness is also involved in heat stroke. You know, the first aid things are what you want to do when someone has a heat stroke. If you suspect that, an individual next to you has suffered a heat stroke, immediately call 911, of course, or transport that person to a hospital. Any delay seeking medical help can be fatal. While waiting for the paramedics to arrive, initiate first aid treatment. Most times, you want to put the person in an air-conditioned environment, or at least a cool, shady area, if you're not around any air conditioning buildings, and remove any unnecessary clothing. If possible, take the person's core body temperature, initiate aid to cool it to 100 degrees Fahrenheit. Other symptoms would be nausea, vomiting, and intense headache with this. While waiting, you can do those things I just mentioned that will address it. You can fan air over the patient while wetting his or her skin with water from a sponge or garden hose. You want to apply ice to the patient's armpits, groin, neck, and back, because these areas are rich with blood supply close to the skin. By cooling them, you may reduce the body's core temperature. You can immerse the patient in a shower or tub of cool water, or even an ice bath. If emergency response is delayed, call the hospital emergency room for additional instructions. There are a few risk factors for heat stroke. Heat stroke is most likely to affect older people who live in apartments or homes lacking air conditioning or good airflow. Other high-risk groups include people of any age who don't drink enough water, who have chronic illnesses, or who drink excessive amounts of alcohol, because alcohol has a dehydration property to it. Heat stroke is strongly related to the heat index, which is a measurement of how hot you feel when the effects of relative humidity and air temperature are combined. A relative humidity of 60% or more hampers sweat evaporation, which hinders your body's ability to cool itself. The risk of heat-related illness dramatically increases when the heat index climbs to 90 degrees or more. So it's very important, especially during heat waves, to pay attention to the reported heat index and to also remember that exposure to full sunshine can increase the reported heat index by 15 degrees. Now, if you live in an urban area, you may be especially prone to develop heat stroke during a prolonged heat wave, particularly if there are stagnant atmospheric conditions and poor air quality. In what is known as the heat island effect, asphalt and concrete store heat during the day and only gradually release it at night, resulting in higher nighttime temperatures. Other risk factors associated with stroke and heat-related illnesses include age. Infants and children up to the age of 4 and adults over the age of 65 are particularly vulnerable because they adjust to heat more slowly than other people. Health conditions. These include heart, lung, or kidney disease, obesity or underweight, high blood pressure, diabetes, mental illness, sickle cell trait, alcoholism, sunburn, or any condition that cause fever can be a risk factor for heat stroke. There are some medications indicated that put you at risk for heat stroke. These include antihistamines, diet pills, diuretics, sedatives, tranquilizers, stimulants, and seizure medications, anticonvulsants, your heart and blood pressure medications such as the beta blockers, the vasoconstrictors, and medications for psychiatric illnesses such as the antidepressants and antipsychotics. Illegal drugs such as cocaine and methamphetamine are also associated with increased risk of heat stroke. People with diabetes who are at increased risk of emergency room visits, hospitalizations, and death from heat-related illnesses may be especially likely to underestimate their risk during a heat wave. According to a recent study presented by the Endocrine Society's annual meeting by researchers of the Mayo Clinic in Arizona, the National Ocean and Atmospheric Administration, and the National Weather Service, check with your doctor to see if your health conditions and medications are likely to affect your ability to cope with extreme heat and humidity, and take care and take heed to protect yourself in this environment. When the heat index is high, it's best to stay in an air-conditioned environment. If you must go outdoors, you can prevent heat stroke by taking these steps. You want to wear lightweight clothing, light-colored, loose-fitting, and wide-brim hats to protect you from the sun. Use a sunscreen with a sun protection factor, SPF, of 30 or more. You want to drink extra fluids during this heat wave, during this hot season that we're coming upon. This will prevent dehydration. It is generally recommended to drink at least 8 glasses of water, fruit juice, or vegetable juice per day. But if you're exercising or you're participating in a sport outdoors or working outdoors, continue to hydrate throughout the day. Because heat-related illnesses also can result from a salt depletion, it may be advisable to substitute an electrolyte-rich sports drink for water during periods of extreme heat and humidity. You want to take additional precautions when exercising or working. The general recommendation is to drink 24 ounces of fluids 2 hours before exercise, and to consider adding another 8 ounces of water or sports drink right before you exercise. Now, during the exercise period, you should consume another 8 ounces of water every 20 minutes. Even if you don't feel thirsty, you should continue to drink water and hydrate. You know, you can reschedule or cancel your outdoor activities if possible. Shift your time outdoors to the coolest times of the day, either early morning or after sunset, especially for that long walk or exercise that you like to do. You can do that in the late evening or early in the morning when it's cooler. You know, there are other strategies for preventing heat stroke. You want to monitor the color of your urine. You know, dark urine or Coke-colored urine is a sign of dehydration. You know, be sure to drink enough fluids to maintain a very light-colored urine. When you see dark urine, you need to hydrate more. Measuring your weight before and after physical activity. You want to monitor your loss of water weight. This can help you determine how much fluid you need to drink. Avoid fluids containing caffeine or alcohol because both of these substances can make you lose more fluid and worsen the heat-related illness. Also, do not take salt tablets unless your doctor has told you to do so. The easiest and safest way to replace salt and other electrolytes during a heat wave is to drink sports beverages or fruit juices. You know, always check with your doctor before increasing your liquid intake if you have epilepsy, heart, kidney, liver disease, or on a fluid-restricted diet, or have a problem with fluid retention. If you live in an apartment or house without fans or air conditioning, try to spend at least 2 hours each day, preferably during the hottest part of the day, in an air-conditioned environment. At home, draw your curtains, shades, or blinds during the hottest part of the day, and open windows at night on 2 sides of your house to create cross-ventilation. If you're a senior who either can't afford to buy or run an air conditioner, check with your local area agency on aging for programs that can assist you. You know, after you've recovered from a heat stroke, you know, if God forbid you have one, you will be more sensitive to high temperatures during the following weeks. So it's best to avoid hot weather and heavy exercise until your doctor tells you that it is safe to resume normal activities. I hope that you can take these points that I have mentioned here today on heat stroke and, you know, keep them in mind as we get closer to these summer months and, you know, the weather starts to get much warmer. The humidity starts to rise, and we're going to have some really hot days ahead of us, you know, in the summer. And, you know, take precaution. Hydrate, dress with light-colored clothes, light clothes, and take care of yourself during this period of time. If you're elderly, you know, seek further advice from your physician. If you're on specific medications that are listed, and might be a good rule of thumb to check with your doctor on your next visit before these summer months begin to find out what other precautions that he might advise you to take. I hope this information has helped you. Please continue to watch our program for future tips that we'll share with you on your health. I'm Dr. Rick Duplantis, thanking the people at AOC, the staff and group here, the use of the facility to broadcast this show. And I want to wish you a very pleasant and good evening. God bless you.